good evening. I'm delighted to introduce to you the speaker for tonight's webinar. It's Dr. Leticia Klausner. She is an international medical graduate who received her medical degree from the Universidade Federal Fluminense in Brazil. Leticia is one of the founding members of the U.S. Spiritist Medical Association and currently occupies the position of Program Director. Her talk tonight is entitled Health and Spirituality, a Brief Overview and Practical Application. In this talk, Leticia will share the scientific research findings on the effects of religion on health, described by Dr. Harold Koenig from Duke University and Dr. Alexander Moreira Almeida from University of Juiz de Fora, Brazil. She will also bring the Spiritist perspective that corroborates the effects of religion on health discussed by the researchers. At the end of her presentation, she will discuss a real-life example of the impact of spirituality in the recovery of an injury. Here is Dr. Leticia Klausner with you.
Hello, everyone. Thank you so much for this invitation to share with you this study called Health and Spirituality, a Brief Overview and Practical Application. So like it was said in my introduction, in this study, I based the information on the research by Dr. Harold Koenig from Duke University. He's a psychiatrist, and Dr. Alexander Moreira Almeida. He's also a psychiatrist from University of Juiz de Fora in Brazil, and he is a Spiritist. So the first thing that Dr. Harold Koenig tells us that is important my slides are not going. Important to define is the difference between religion and spirituality. For some reason, my slides are not changing. There we go. So for Dr. Harold Koenig's research perspective, he defines religion as the beliefs, practices, and rituals that are related to the transcendent. And depending on the religion tradition, this transcendent is called a different name. It can be called God, Allah, and so on and so forth. Religion also involves beliefs about spirits, angels, or demons, and you usually have specific beliefs about life after death and rules to guide behavior. It is often organized as a community, but it can also be practiced alone and in private, and is rooted in established tradition that arises out of a group of people with common beliefs and practices. So this definition is a better definition to use in the research perspective because it's an agreed upon definition, and science can measure and quantify it and correlate it with health outcomes. On the other hand, spirituality is more difficult to define than religion. It's a more popular expression, and it's considered more personal. Each person will have a definition for themselves, and that is free of rules, regulations, and responsibilities. So it is harder to use in a research methodology. Everyone is considered spiritual, even those that are non-religious. So both religious people and non-religious people are considered spiritual. So in the models that he proposes, we can see research model on the left side of the slide, where we have the circles that says spirituality is a bigger circle, with religion a smaller circle that is inside of spirituality, versus secular or non-religion. And on the right side, we have more of the clinical application view, where spirituality permeates everything, religion and non-religion. So the key points that Dr. Koenig points out to us is that when we are talking about research, it is done in terms of religion. And when we are talking about clinical applications, the term spirituality should be used because it's more inclusive. So religion is easier to be measured because it's something that you can ask a person. How often do you attend service? Do you volunteer with your religious community? What type of role you play in your religion, and so on and so forth. So Dr. Koenig brings to us the importance of religion as a coping behavior. So many people turn to religion for comfort when stressed. And religion is used to cope with problems that we are faced in life, especially medical or psychiatric illnesses. For example, uncertainty. You receive a diagnosis, you're not sure what's going to happen to you from that point on. Fear, you might receive diagnosis of a disease that doesn't have a straightforward treatment, for example. Pain and disability, loss of control, and discouragement and loss of hope. So Dr. Harold Koenig is one of the pioneers in the research of religion, health, and spirituality. He has several works published, and the information we are going to bring next, he brought to us from several works that were published since 2001 until 2012 on those handbooks of religion and health. So through those research, they were able to see the effects of religion on health outcomes. So the first category of health outcomes was in mental health. And they were able to see in the studies the effects on depression. So there was less depression and faster recovery from depression in 272 out of 444 studies, which is 61%. I'm not going to be reading the percentage from each health outcome that he discussed. It's just to show you the impact, or how robust was this effect and how many studies visualize that. So in the case of depression, even if the person was depressed, the studies showed that those with greater religious involvement, they had greater purpose and meaning, greater optimism and hope, more gratitude and thankfulness, and more generosity, which was factors that impacted their recovery from depression. The second health outcome was on suicide. So there was less suicide and more negative attitude towards suicide on the people that classified themselves as religious. And Dr. Koenig's comment was that a religious worldview gives people a reason for living. It gives life meaning, especially to those with chronic disabling medical illnesses or that are faced with life-threatening medical diagnosis. On well-being and happiness, there was greater well-being and happiness. There was also an effect on meaning, purpose, hope, and optimism, with all those were increased in the religious population. So all those criteria, they show consequences for patients, motivation for self-care, and effort towards recovery. And when a patient has more motivation for self-care, it affects disease prevention with behaviors that they will have that will avoid becoming ill in the first place, and then also with having a better recovery from illness. There was an effect on alcohol use, abuse, and dependence, with decreased use on those that were religious, and also decreased illicit drug use. The next aspect was social support. So there was greater social support on the religious population. And he pointed out that was the active and participative involvement in a religious community that was the strongest predictor of overall health. So it's not only being calling yourself religious that shows this effect on social support, but being an active member of that religious community. And there was also an effect on the delinquency and crime with a decreased involvement in those actions. There was also an effect on divorce, domestic abuse, and single-parent families with greater marital stability. And then going to the next category was on the effects of religious and health behavior. So the first points he analyzed was exercise, weight, and high-risk behavior. There was greater exercise and physical activity with the religious population. There was a less extramarital affairs and safer sexual practices in those that were religious. But there was higher weight, which was a negative association they saw in 39% of the studies. So one thing to think about with the religious community is how can we encourage people to have a better behavior towards a healthier weight. Then cigarette smoking, there was less cigarette smoking, especially amongst the young people that would not even start to smoke. And then the next category was the religion effects on physical health. So first they looked into the effects on cardiovascular disease. Heart disease is one of the leading causes of death in the United States. So they were able to see a lower blood pressure in the religious population, better overall cardiovascular function, and less coronary artery disease. There was also an effect on the immune and endocrine functions with a better immune function and decreased inflammatory markers on the religious population, and a better endocrine function with decreased stress hormones. And the studies that show that the majority of them involve the practice of meditation. And then the overall mortality of the different populations, the religions and non-religions. So in Dr. Koenig's opinion, those were the best studies to show the overtime effects of religion in a person's length of life. And they demonstrated an increased longevity in the religious population. There was a difference between ethnicities. In Caucasians, it was reported an additional 7 years of life. And in African Americans, it was an additional of 14 years of life. So with Dr. Koenig's studies, we can see the effects on health. But now with Dr. Alexander Moreira Almeida, he brings us a hypothesis on how does religion bring those effects? What would be the mechanisms? So the first mechanism suggested by Dr. Alexander Moreira Almeida is the lifestyle. He says that religion brings a positive health behavior. It is an incentive to take good care of the physical body, brings us recommendations against alcohol and drug use, and discourages of risky sexual behaviors and reprimands of violent behavior. So I brought a correlation from the Spiritist religion with some of the codification that brings exactly this information to us. I'm just going to give a citation for each one because each one of those could be a separate lecture. So in the Spirit's book on chapter 20, Spiritism talks about the law of preservation, which goes with taking good care of your body. On the Gospel According to Spiritism, on chapter 8, we have teachings about sinning in thought and adultery that goes with discouragement of a risky sexual behavior. And also in the Gospel According to Spiritism, we have the chapter on affability and meekness that talks about not being violent, which goes with the reprimand of violent behavior. The second mechanism suggested by Dr. Alexander Moreira Almeida was social support. So being part of a community and feeling at ease to ask for and receiving help. So trusting those around you, your fellow community members, and that was related to a better quality of life and overall health. So the correlation in the Spiritism teachings we have again from the Gospel according to Spiritism, corporeal kinship and spirit kinship, that talks about our family relationships, that goes beyond our blood ties. We also have a spiritual family where we have spiritual affinity to those that part of our community. And then in the Spirit's book, we have the Law of Society that explains that why we are beings that live in a society versus isolated in a mountain, right? There is a need for us to be around our fellow human beings. Then the third mechanism suggested by Dr. Alexander Moreira Almeida is a cognitive framework. The cognitive framework is a belief system. It's a way of thinking that gives meaning to ideas and teachings. It also can give meaning for suffering, giving a reason to cope with the illness. It gives us cognitive resources that help people overcome stressful and challenging situations. And I like to call it a mental library. So through our religious teachings, we are building this mental library that frames our way of thinking that we're going to use when we're faced with challenges. So the correlation from the Spiritist doctrine is in the Gospel according to Spiritism. We have the chapter about the future life that tells us that this life doesn't end with the cessation of life in our physical body. Then also in the Gospel, we have the chapter on the cause of earthly miseries that explain to us about our sufferings. Also in the Gospel according to Spiritism, chapter 5, we have the chapter on blessed are the afflicted. And on Spirit's book, we have the purpose of incarnation that all give us meaning to our life. So this is a lot of information, and I wanted to bring this as a foundation. Like I said in the beginning, it was a brief overview. Why? It's a foundation to build upon the real life example we're going to discuss shortly. So this real life example happened with me. I have one more mechanism suggested by Dr. Alexander Moreira Almeida. That's the religious practices before we go to the practical application. So different religions have different practices, and the ones that have been studied are prayer, meditation, trance, and altered states of consciousness. So in the Spiritist doctrine, we have the correlation in the Gospel according to Spiritism for ask and you shall receive, that talks about prayer. Also in the Spirit's book, we have the chapter on the law of worship that also explains to us about prayer. In the same book, on chapter 12, we have the explanation on the liberation of the soul that talks about trance and altered states of consciousness. So all this is very important to know so we can go to our practical application. So I didn't know I was building this mental library until I was challenged by a real life event. So on the morning of April 6, 2015, I was driving to work. It was early in the morning, the sun was coming up, and then suddenly I felt a forceful impact on the right rear end of my car that jolted my car forward. It changed the speed and direction that my car was going, and I started going diagonally to the left towards some trees. In order to avoid the trees, I turned my steering wheel to the right, and next thing I knew, I had pain in my nose. So I looked down and I saw the steering wheel with the airbag deployed. And then I realized that was upside down. At that moment, I started feeling a lot of pain all the way in my torso, from my neck to my pelvis. And without thinking too much how I was going to get out of that position, I released my seatbelt, and I was very fortunate to fall with my back flat on the roof of my car. At that moment, I was able to reach the cord that was charging my phone, and I was able to call my boyfriend at the time, that now is my husband. And as I was speaking with him, a passerby opened my passenger door and asked me if I was calling 911. And I said that no. And he said, don't worry, I called 911. So I explained to my boyfriend that I was in the car accident and that I was going to be taken to the hospital. I was in so much pain that I couldn't talk too much. But I really didn't want to be alone at that time when that life-altering event had happened. So I put my phone on my purse that had fallen right by my side on the roof of my car. And then a police officer opened my car door and took my purse. The paramedics arrived. They assessed me. I explained to them that I didn't hit my head and I hadn't lost any consciousness, but that I was having a tingling sensation from my neck down to both my arms, that I was in a lot of pain from my neck to my pelvis. I couldn't stretch my legs, so I had to keep my knees bent and with my legs supported by my feet. And they put the cervical collar on me, did all that is needed to be done in a car accident scene. They dragged me out of the car, put me on the gurney, and then I was in the ambulance in the ride to the hospital. It was very long ride, it felt to me, and I could feel all the little bumps on the road would make my pain worse, and I felt like it was taking a long time. So I asked the medics where they were taking me, and they said they were taking me to shock trauma. And all I wanted was for them to let my boyfriend know where I was being taken. So remember what the Dr. Koenig had said, why we use religion to cope. You know, there was uncertainty, fear, pain, loss of control. I was feeling all that at that time. And it's really hard to be in that situation. So I was taken to the trauma bay. All these medical professionals were around me and assessing me. And I had been in a trauma bay before, but I was not the patient. I was one of those professionals that are all around you. And it really gives you a perspective when you are on the other person's place. They were all talking to me at the same time, asking me questions and examine my body. And there was a total loss of control there. And it's totally understandable when you are in the trauma situation. There are things that need to be done fast, but that person that is there is at the most vulnerable state they ever been in their life. And I think that's something that I learned in being in that position. So after all the assessment, was discovered that I had fractured one bone. Luckily, it was my second lumbar vertebrae. I was lucky that there was no spinal cord injury. And after 3 days in the hospital, I was given a brace to wear that immobilized my thoracic, lumbar, and sacrum. I was in so much pain for all this period of time that I was in the hospital. The greatest pain I've ever experienced in my life. And not only physical pain, but there was emotional pain. There was a loss of control. There was this fear. There was the uncertainty of what had happened to me until I had all the answers. And without knowing, I was able to access that mental library, that cognitive framework, and started using it from the beginning. So applying it, using those mechanisms that Dr. Alexander Moreira Almeida suggested to my personal experience, I can see how religion was able to help me undergo this situation. So lifestyle. Dr. Alexander Moreira Almeida said that religion brings you a positive health behavior that helps you take good care of your physical body. So once I was discharged from the hospital, I was given physical therapy to do. And physical therapy is something that's very helpful, but it's very uncomfortable to do too. So I had this like love-hate relationship with my physical therapist. But because I knew I had a role to play on my recovery, I did all those exercises. And I had the support from loving friends and even my furry nurses that I have there in the pictures. Then social support, being part of a community. So I am a religious person. I attend my religion, and I'm lucky that through that I was able to meet a lot of people that did not hesitate to help me when I needed. I had friends that would come and wash my hair, for example, because I had to wear the brace 24 hours and I could not take a shower, for example. So when you cannot take a shower, having your hair clean feels pretty good. I had people bring me meals. I had people that would just come and talk to me because I was just at home enduring the recovery and being in a lot of pain still through this recovery. And like I said, it's not just physical pain. The physical pain is pretty hard, but the emotional part where I lost my car in the accident, I couldn't work. I lived in an apartment that was on the 3rd floor with no elevator, so I couldn't go back to my apartment. I was very lucky that I had my boyfriend that took me in and took care of me. I'm an immigrant in a foreign country, so I thought I was alone without family, but I found out that through my Spiritist family, I had lots of very good company. So that was a big aspect in my recovery. Then the cognitive framework. That was the really interesting part because we are never challenged on how big our mental library is until you are faced with this situation, right? So since my first day in the hospital, I chose to have like classical music in my room so I could have this positive environment around me. I chose, you can see I'm smiling in the picture because I wanted to feel good. And I didn't want people to feel sorry for me. And I wanted to feel good. So I was smiling. People would ask me, how are you doing? And I would be like, I'm doing good, even though I was in pain. And all of that was going on. I made this choice because I learned another thing with pain. The more I focused on my pain, it was as if everything there was pain. I literally felt like it was dragging me down and that the pain was going to be where that I was being dragged into this pit of pain. And I made a conscious decision to not go there. And in order to do that, it took a lot of watching my thoughts, doing everything that I could to keep them positive. So with the classical music in the hospital, from attracting positive reaction from people. And once I got home, I was able to listen to Spiritist books online. And even if I couldn't read because the pain medication was making me tired and sleepy, I still made sure that I was at least hearing the teachings from Spiritism. And when I point this out and correlate with the teachings from the research we saw, it seems like easy, but it was not easy, and it was not a straightforward improvement. Some days you do better, some days you do worse, but you just keep trying your best. And it was not easy, it was hard, but because of the Spiritism, the lessons I have learned from Spiritism, I believe it really made a positive impact in my recovery. Then on the fourth mechanism that Dr. Alexander Moreira Almeida discussed was the religious practices. So I prayed that I prayed that, thanking God that I didn't have nerve damage. I thank God that I only broke one bone. The other thing is that the person that hit my car was never found. So it was a hit and run. And I didn't spend more than half the first day thinking about who that person was, or why would they have done it, or where were they now? Because deep in my heart, I knew that there is divine justice, that I did not have to worry about making justice myself. And then I was able to let go from who was this person that was the cause of my suffering. And I thank God that I was able to let go, because that made it much easier for me to focus on myself and my recovery. I also went to the Spiritist Center and I received the spiritual treatment called passes. Even when I was in the hospital, I had some friends from the Spiritist Center come and give me passes. And when I was able to ride in the car, I would go to the center before service and they would give me passes and I would go home because I couldn't sit for the service because my back would start hurting so much from sitting for a long period of time. But I was very thankful too that I was able to receive the spiritual treatment to help with the recovery from my injury. And now, 4 years later, I can say that I'm doing pretty well. My back's not the same as it was before the accident. I have driving anxiety, which brings me another challenge every time I have to drive. But I am very thankful for Spiritism and for all the Spiritist friends that I have, and for my recovery to be as well as it is. I know people, they might get addicted to pain medication once they have injuries like mine. And I was able to use the least amount of pain medication because I had all those other resources at hand. And when we bring it all together, the real life experience with the research, we can see how it really improves patient recovery. So I'd like to say thank you. And if you want to know more information about health and spirituality, you can go to our website, www.sma-us.org, or to our YouTube channel, which is Spiritist Medical Association. There are several videos there from researchers like Dr. Harold Koenig and Dr. Alexander Moreira Almeida. Thank you.